So now tonight, I wanted to meet because there's so much in the news right now about the vaccine. So we started this week meeting. This week I've met 3 times already this week with our local Department of Health. So we're starting intensive meetings about the vaccine, about deployment. So I wanted to start sharing the information that we have. This morning, we met with all of our agency providers, our ICF providers. We then met with the independent providers. Right now, we're meeting with you all, and in the morning, I'll be speaking to all of our staff. So I think this is the best way for us to move forward, is to share all the information in a very timely manner and make sure that we're all on the same path, moving the same direction, and that we have a good, solid understanding of where we're going. I think sharing information and answering questions is the best way for us to proceed, because it's so many moving parts. That's the best way I can describe it. And so many different things happening that we've never really had to look at before as a system. So that's kind of my introduction. I'm going to share a little bit of basic information, and then there could be those of you on the call who need to correct me a little bit, and that's fine too. And then we'll have a time for questions and answers. I've already received a few really great questions in email, but I want this to be a time of information, and then I see us doing this at least once a month, or anytime abundant new information becomes available. So when something else happens, we'll definitely come together and share the information that we have. So as you've heard, they're beginning to distribute the vaccinations, and it's been divided into groups. So right now they're looking at vaccinating the groups that are categorized as 1A. So for the purposes of this vaccination, those that fall within 1A are people that relate to us, to our system, are people with developmental disabilities who live in congregate settings. So those are people who live with at least one other person with a developmental disability to qualify for 1A. That's the very, very first release of the vaccination. So that is how that is being interpreted. So And that's different than how we interpret a congregate setting. So it could be 2 people with developmental disabilities living at home with their parents. That qualifies as a congregate setting for this definition. It's 2 people with developmental disabilities living together, whether it's at home with family, whether it's on their own in an apartment, or whether it's in an ICF or a residential home. Now, I'm going to stop there and see if anyone has any questions or discussion around that definition of a congregate setting.
I have a question. My son lives here. He resides here with me, but then I also have a client that comes in here.
In here.
Okay, I can almost hear you. Maybe your finger's on it. Okay.
Can you hear me now?
Yes, yes.
Okay, I'm sorry.
That's
I
okay.
have a son that resides here with me, as well as I have a client that comes over to my home. Would that qualify, either one of them?
And your son has developmental disabilities?
Yes, ma'am, and so does my client.
And the client doesn't live there, but you serve him in the home?
Mm-hmm. He
Okay.
comes over Monday through Thursdays in the afternoon after school, and on Fridays he's here all day because he has no school. They do remote.
And so that could be an exception to the case. And is it Rolanda?
Okay. Yes, ma'am.
So Mitch Snyder's on this call. You'll see him right there. So he'll be somebody that you'll need to reach out to, or that we will follow up with you. If you'll write down her name, Mitch, because
Yes.
there are specific
Thanks, Mitch.
exceptions depending upon the care that's provided. You know,
Okay.
so any other questions around that congregate setting definition?
Yeah, what if my son obviously special needs, he's had cancer in the past, but so have I, but I'm not special, does that fall in that category?
Wait, I couldn't hear the first part.
Okay, my son's disabled and he's had cancer in the past. I've also had cancer, but I'm not special needs, does that qualify or no?
I can't understand you. I'm really sorry.
No,
Let
it's
me-
fine. I think I heard it, Pamela. You
I
said
know.
one because of health issues has disabilities. You've
Wait.
had health issues, then you will not qualify unless there are two people in the home with developmental disabilities.
Right.
Okay.
There have to be two people. You will qualify soon, but not for the 1A distribution.
Okay, so it'd probably be the 1B.
I believe it's 1C, but I don't have it right in front of me. We have a slide that's going to show that in just a second.
Okay.
We have a PowerPoint.
That works.
Just what you all wanted on a Thursday night.
Why not?
Oh, and I see Emmanuel. You know, it's like an answer to my prayers, Emmanuel. He works with Zeke's Pharmacy, and he created the PowerPoint that I was going to show you. So yay! So he's here to help provide additional information around the vaccine. So that's kind of how we're starting. It will be with the congregate settings. So we're working with the providers to see if they have registered with the National Pharmacy Program. A lot of them did not. And so we will be working with providers like Zeke's Pharmacy and the health department in order to get those vaccinations to those providers that qualify for that 1A. And for the people, of course, living there with developmental disabilities. So we will be working. And one thing I did want to reassure everyone is that the Department of Health and our system, everyone is aware of the number of vaccinations that we will need. So we need thousands of vaccinations, even for the 1A piece. So we have a lot of people living in congregate settings and direct care staff who serve them on a daily basis. So I don't want anyone to be fearful that the vaccines will run out or that you will be missed with the vaccine. So we are making sure that everyone who receives services through us and their care staff, that they are accounted for. So you do not need to be concerned about that. Now, the vaccines are coming in slowly. So that's the information from the Montgomery County Board of Health, that it's not like they're going to receive thousands and thousands of vaccinations up front to get started. They're coming a little at a time. So the entire process for this 1A distribution will take a while.
Yeah,
Probably through January or maybe even a little later. Like, it's going to take a while to get enough vaccines into each county in order to have everybody receive the vaccine who would qualify. Okay. Yes, Dr. Komorowski.
I just have a question about the logistics of it. How are they going to manage getting the special needs adults vaccinated? Will they go somewhere? Will it come to them? How is that going to be handled? Did they talk about that?
Yeah, so the Department of Health, they're working on a plan. They're hoping that we can partner with pharmacies like Zeke's, because Zeke's will have added pharmacists and staff that will go to the locations. Hey, Rolanda, can you put me on mute? Thank you. And so Zeke's Pharmacy has agreed, they partner with us on other projects where they can actually go to the ICF or the waiver location, especially at the locations where it would be very difficult for people to leave and to go get vaccinated. The Department of Health for Montgomery County has also pledged that they will meet that need. So they do not want our folks to have to go down to the Board of Health and stand in line. So they've agreed to also work out if they needed to set up at Northview or a location for some of our staff and folks. And then if they needed to go to ICFs and waiver homes and things like that. So it's going to be quite the project. The Board of Health has actually planned, they've actually said that they will probably have to close a couple of days a week for their normal operations in order to go and give vaccines. So it's a tremendous undertaking. And then just one more thing related, this is something that came from the state, is that they said their understanding is that a pharmacy might have I don't want to say permission slip. What is it? A consent form. I need to write down all my new terms that I'm using. So a consent form. And the state is trying to get one that's specifically for the people we serve, but that's still being worked on. So consent will need to be given either by the person if they're a self-advocate or by their guardian. So there will be something around that. And then at the time of vaccination, there's like a general health screening. And then after the vaccination's given, just like most vaccines, there's a period of about 15 minutes or so where you need to kind of rest and see if there's side effects. So, and then there's another shot that's given, I forget how long it was, Emmanuel, 3 weeks, 3 weeks. Yeah, 3 weeks to 28 days or something like that. So it's going to be a process. Now, I'm going to stop for just a second. Emmanuel, do you have time to show part of that PowerPoint? Because I think it will answer a few more questions.
Yes, I can do that.
Okay, thank you. If that's okay with everyone,
All right. Okay, just give me 1 second here.
Zeke's Pharmacy works with us on different projects because they're willing to go and provide pharmacy care at our different locations, which is a wonderful benefit for our population and for people who might have greater difficulty going somewhere, like to a CVS and standing in line. So we're just really grateful for their willingness to step in.
So the physicians won't be able to give it to them? Like your doctors?
It will depend upon if they have signed up to do that. And I think a lot have not, is my understanding. Is that correct, Dr. Komorowski?
Yes, I think most offices have declined because there's a tremendous amount of paperwork, watching. You need a huge facility to keep people apart too. And most of us on our offices don't have that much space. So
It was
most docs haven't signed up.
Yeah, it was a lot.
All right.
And then also the temperature for, like, there just seem to be so many hurdles around giving the vaccine.
All right. Can you hear me? Can you all hear me?
Yes.
All right. My name is Emmanuel, like Pam said, and I work at Zeke's Family Pharmacy as a clinical pharmacist. So I'm just going to give us an overview of how the vaccination process works and where we are at in terms of, getting the vaccine.
Join the meeting.
As I mentioned, we were looking at the way the vaccine will roll out. So this is just a timeline of how the vaccine is going to work, or how the vaccine is going to be distributed. Phase 1, like Pam said, is going to start December. It's already started, and that's going to go on up until mid-February. And then phase 2 would go from February to April, so and so. The important thing to know is that in phase 1, you're going to have, a limited supply of the vaccine, just as Pam said, but that's going to be ramped up very quickly. We hope that as, the 2 vaccines get on board, there's going to be enough sufficient supply, thinking around sometime in late January / early February. That's what we're hearing in the news so far. So, phase 1 is going to be a lot of healthcare professionals who work with people who might either have COVID or are at high risk of getting COVID. And phase 1 is also going to include people that live in congregate homes, like Pam said. So if you have, for example, I know Pam has said this like 10 times already, if you have, a family with 2 kids and those 2 kids have a mental disorder, they will be qualified to receive the vaccine in the phase 1 process. Okay. So essentially, phase 1 is split into 3 processes: phase 1A, B, and C. So phase 1A, like I mentioned, healthcare professionals and personnel, and the long-term care residents will be in phase 1A. So just to give you the assurance that the government is prioritizing you as as phase 1 to receive the vaccine. So that's really good that we're hearing that. Now, again, this is just a better understanding of who those who are included in phase 1, the hospitals, the long-term care facilities, the outpatient clinics, pharmacies, assisted living facilities, and other residential care are considered for the phase 1A to receive the vaccine. Okay. Now, earlier this month, I'm sure Pam must have mentioned this about the pharmacy partnership program that the government had put out with CVS and Walgreens. Unfortunately, there was such a short time for the process to be put in place, and a lot of providers we're finding didn't know that there was an option for that. So we're really trying to step up the game and put in our best effort to serve the community and make sure we're able to provide this vaccine. So again, like I mentioned, CVS and Walgreens and a few pharmacies around the country, we're among that, the participating pharmacies for the partnership program. Okay. And like I mentioned, the program deadline ended in November 6th, and unfortunately, we haven't had any word that facilities will be able to join that program, and that's why we at 6 are really trying to do our best to serve and provide the vaccine. We have already gotten all the necessary supplies. We have everything we need. All the staff are trained. We have about 4 pharmacists on standby, waiting to go to locations. We have the proper cold management equipment. So we have everything basically good to go. The only thing we need is just the vaccines, and we are working closely with the Ohio Health Department, and they are supposed to give us a feedback by tomorrow to let us know when we'll be receiving the vaccine and how much we will be receiving. So once we get all that information, we will work closely with with you guys and ensure that we are able to come in, set up a clinic date, provide a vaccine, document it properly, and schedule the time that we're going to come in for the second dose. Like Pam rightly mentioned, the Moderna vaccine is also a 2-dose vaccine. You get the first one and then you get the second one 28 days after, while the Pfizer's vaccine is 21 days in between. So we're really looking forward to really support the community in the best way we can. And we're going to be doing all our best to provide a vaccine at the maximum of our capacity. But yeah, if anyone has any questions about how the process looks like, what's going to entail.
So Emmanuel, I have a question. I'm going to interrupt you. Thank you for that excellent presentation. So one thing back on the slide where it talks about 1A, 1B, and 1C, a lot of the people we serve will also be in phase 1C. And those would be those not living in congregate settings,
That's great.
but at risk. And so I just kind of wanted to show that they're still in the one
They can still be
group,
young
in kind of the priority group.
Mhm.
Is
Yeah.
someone talking to me? Okay, and there was a question, Emmanuel, about the cost. I haven't even found out yet about the cost. Do you know, privately, are people asked to bill their insurance, or does anyone know that yet?
Yes, so the guidance we're getting from the health department and the CDC is that we will be billing their private insurance for the administration fee. We're only billing for that. The vaccine is provided by the government for free. So we're
Okay.
not charging, essentially no facility is going to be paying
Okay.
for anything.
Okay.
That's the bottom line. In cases where there's no insurance for that specific patient, we're not allowed to bill, individuals for the vaccine. So
Okay.
the rest assured that no one is getting charged for receiving the vaccine.
Okay, that's
There's also-
excellent news, Emmanuel.
That is great to hear. So there's also a second question about consent forms.
So those, no one, well, go ahead, Emmanuel, if you have.
Yes. So with the consent forms, I'm not too sure which form you referred to that you said the Ohio Health Department is working on for you. But in pharmacy, in our requirements to document everything, we already have our own consent form that, essentially is approved by the Ohio Board of Pharmacy. So all we need to do is before we go into the clinic for the clinic day for a common site, we provide this document to the coordinators, and they'll print us out, have everyone who's going to be interested in getting the vaccine go ahead and read the consent form, sign a form, and we will just come in there, review that form, ensure that everything is okay, administer the vaccine, and document on our computer systems. We have a backdoor where we're going to report all the vaccines being given to the state's immunization database. So that's already been set up. All we need to do is, just get the document, upload that into our system, and it's reported to the Ohio state government.
Okay, thank you, Emmanuel. So for a lot of those people that we serve, their SSA will be helping to coordinate getting that consent form, especially if a guardian needs to sign, or if we need to make sure that the paperwork is in place for the vaccine. So either the residential provider, we're still working out the details. In a lot of cases, I think our larger residential providers would work to make sure that all the paperwork was ready to go on vaccination day.
All right, awesome.
So there was one question in the chat box, and it said, how will a person with a cognitive issue give consent for being vaccinated?
And that would be the same as any other medical decision. However, that person makes decisions related to anything medical. And then if that's still a question, then they would reach out to that person's SSA, and they could give them specific rule guidance around that person.
How will we know it's our turn? Do we get emails or phone calls, or how does that work?
So yes, so we will be working on that. So that's part of kind of this huge process that we're working with the Department of Health on. So when it's time, if you qualify for 1A or 1C, whatever the case may be, we will be reaching out for that person with a developmental disability to make sure that they know when it's time, or their family knows when it's time for them to get vaccinated.
Is that by phone or email or both?
We haven't set up all those steps yet. I'm guessing most of that is usually done by email so that we have record of it. And then I'm guessing we would follow up by phone if we weren't able to reach by email.
Okay.
Right now, we're sending out a lot of things like in family newsletter updates. So as we get information, like if we find out, okay, 1C, you know, February, whatever, and we kind of get that date, we'll alert you to that upcoming news as we know about it.
Okay. So with 1C, does it always have to be 65 and older with for special needs or no?
No, it will be adults. My understanding is that it's adults with those high-risk medical conditions. And there's a list, this is, you know, just kind of the title of it, but there's a list of qualifying items under that category that for people served by our system, they would meet that criteria.
Okay.
So the good news is that we will be in the first group, the people that we serve and that we love. So I know for a lot of you, you have maybe one family member living with you who's receiving services. So that person receiving services would, my understanding is they would fall under the 1C.
Okay.
So in phase 1, but not 1A or 1B.
All right. Okay.
And I see that there's a question here regarding the people under the age of 18, and I can quickly answer that.
Okay, thank you.
Yeah, so for the Pfizer vaccine, and the Pfizer vaccine was only studied in people 16 years old and above. So right now, the recommendation is to, you know, not administer the vaccine to people less than 16 for the Pfizer vaccine, and the Moderna vaccine. You know, it was studied in patients 18 years old and above. So we really don't know what the CDC is going to do regarding vaccinating, you know, adults and children and things like that. So we're still waiting for more guidance. But for now, the general consensus is that, you know, we do not administer the vaccine to anyone that's less than 16.
Okay, thank you. I did get an email question asking for our clients and the people we serve, will they be offered by acuity? So it's not being broken down into an acuity level. It's those living in congregate settings and then those not living in congregate settings. So that's the differentiation for this process.
Okay.
So my understanding, I'm answering the question in the chat, and we will follow up and get more information. My understanding is that if somebody is living home and they fall under 1C, we have been asked to provide counts so that the people in that house would be able to get vaccinated. So for each person we serve, we've added the people who give their care.
Oh.
Okay. Is Kamar on the call?
I don't believe so yet.
Okay. He's the one who just turned the numbers in about 10 minutes ago. So that's what we were counting. It took us forever to count it because it's a different way to count than typically we do. But for each person served,
Greg Braylock.
Join the meeting.
We added on like maybe their independent provider, their parent, like I'm not sure, I don't think it would extend to siblings who are not receiving services or providing care. But so all of those definitions still have to be kind of defined for us. But right now, the people providing care would be qualified as well. Are there any other questions in the chat?
I have a question.
Yes, Despina?
How are you?
Good.
I'm asking about the safety if there is an allergic reaction. If the pharmacy that is going to provide the vaccinations, if they are ready to react in a situation of an adverse reaction?
Yeah, so I can answer that question. So so we're fully prepared. We have EpiPens, which is the epinephrine pens that will be administered in case of an allergic reaction. And we have a protocol in place that we would follow if there is an allergic reaction. Typically, people that are likely to have an allergic reaction will be identified with the screening questions. So there's going to be some screening questions in the consent form that will be signed. And if someone has allergies to eggs and peanuts, and it's just someone who has allergies generally, we would screen that person and not provide the vaccine to that person, because at that point the risk of getting an allergic reaction is high. So that's a good question. We do have a protocol in place.
Thank you. And for practical reasons, I read a lot about the reactions. People, they might feel a little bit off the next day. Do you have a plan if a congregate setting is vaccinated altogether, or you are going to do like a few people in, so there is staff that can provide services to the clients?
Right. So that's a very good question. So those things we just started today, and we're just starting on kind of those decisions, but I will take those thoughts back to the team.
I see another question in the chat. Do we have a choice in which vaccines we get? So we don't know the answer to this question because it's going to be dependent on the vaccines that we receive. The only thing we know so far is that both vaccines are comparable in efficacy. And if you take the first dose of one vaccine, you have to take the second dose of the same vaccine. So we do not know, if we're going to have both of them, both vaccines. So it's going to depend on what we have available. But definitely, people do have the choice to pick, what they want.
And I'm getting a lot of questions just in email around if the vaccine is being mandated. And so the vaccine is not being mandated. So people have a choice. And that's really all I have to say about that right now. Like, that's the status right now, that people have a choice whether or not to get vaccinated. All right, and I saw a question about who should we ask about questions. And right now, I would really like for you to send your questions to me, just because I'm just putting all of my focus on this, and it will help me as I'm having daily meetings with the Department of Health and everyone and the providers, just to know all the questions as they come in. And you probably know how to contact me, but my email is the letter P and then Combs. Oh, thanks, Janice. That was just a little bit more efficient. There it is. So I look at my email all the time. It's so handy. They have it on my phone too. So it's with me always. And all questions are good. And then it will help me to know what you all are thinking, and I can work to get the answer. So this is just unprecedented. All right. And any other questions or comments? My goal with these parent meetings is to meet regularly, especially as things change or get updated, and at least every few weeks. I did see the question about how long until you're safe after the vaccine, and I thought that was really interesting, Emmanuel, when you shared that this morning.
Yes, so the vaccine, let me see if I have the slide here, but the vaccine would really only kick in Actually, it's not in the slide, but the vaccine will kick in. So essentially, you take the first dose, about 5 to 7 days, you get about 50% coverage, which is not enough. And then after the second dose, then you get your 90%, about 10 to 15 days after. So we're looking at give or take 50 to 60 days after your first vaccination, that we know that the vaccine is going to provide some, good coverage.
So we're going to need to use PPE for quite a while.
Yeah.
So I know you all know that we provide free PPE at our Northview location, and Mitch Snyder, this has been his year of managing a pandemic resource center. He never saw this coming. So
Great new experience, though. I've learned a lot.
something to put on that resume, not that you're ever leaving.
I'm not going anywhere. Don't even.
So you let him know if you need things, because it's once even these get started, just for everyone to get vaccinated, and even if you get a vaccine, then to wait the period of time, that's still a long time.
And we've committed that the resource center is going to be open at least through the end of March, but it'll be open as long as people need stuff.
Yeah, as long as we need it.
Yeah, if you guys need something, masks, hand sanitizer, cleaner, whatever, please reach out to me, reach out to the resource center. You can find it by email, help@mcbdds.org, or you can call, I'll put it in the chat box, the phone number. We have a hotline as well.
Yeah, and we only have it published that it's open through March because I have to reevaluate every so often, or the financial people, go crazy on me. But I'm sure it will be open through the summer, just based on how long it's going to take for the vaccinations to roll out to everyone and go through that waiting period and get to a safe place. So just know that we will be providing those items as long as they are needed.
I have a question.
Go ahead.
I know I had emailed Mitch before, and I had to clarify the reason for my request for the amount of supply that I did ask for. And now, Mitch, you know that I service not only my son, but also, the other client. So when I'm asking for items like one roll of paper towel, is there any way that we can somehow get a little more so we're not coming up there so often or having to email so often?
Rolanda, if
supplies.
you want to contact me, we can talk about that specific item individually.
We can work that out.
Be careful sometimes, because sometimes we're low on supplies, and that is a factor as well. I'll tell you, there's a shortage on stuff, and so we do have to control some of that. But give me a call or an email, and we can talk.
Okay, awesome.
So we have a question in the chat. What about people under 18 who have DD?
And so, as far as the vaccinations?
Yes.
Are vaccinations even being offered to children, Emmanuel?
Yeah, so that's no, they're not. So like I mentioned, for the Pfizer vaccine, you have to be at least 16 years old to receive it. For the Moderna, you have to be at least 18 years old. Just because of how the studies that were done were only on those age groups. We're still going to see what happens in the nearest future, what we're going to do, if it's going to be safe to give it to children, but we don't know yet. We have no data on that yet.
Okay. All very good questions.
We have several questions in the chat box from folks who have a family member living with them, and they want to know where they would fit in the schedule.
And so if somebody with developmental disabilities is living with a family member, you would fall in the 1C category. So you would still be in the 1 priority group, but you would be at the end. of the one group at 1C.
And just to reiterate one thing, the phase 1 process is supposed to last from, December to mid-February. So, that's the time difference is not that, long. So it's going to be at least within the same time, even though you might be phase 1C versus 1A. It shouldn't be more than a month apart at the worst case scenario. So it's pretty close, and production has been ramped up. That's the main bottleneck in the process.
That's a good point, Emmanuel. And that's what the Department of Health said as well. Their biggest concern, besides figuring out how to get everyone vaccinated, was also getting the vaccinations, that they received only so many. It's nowhere near enough for the 1A, like nowhere near. And then they don't know when the next shipment's coming. It's not like there's a deployment plan. They said it's not being handled at all the way that H1N1 was handled or any previous deployment, that this is completely different. And they really, they'll receive them as they receive them. Any other questions, Janice?
Not that I see in the chat.
So I know it's not a ton of new information, but I did want you to know where we're at as a system, what it looks like for our population and those that we serve. What was the question, to repeat the timeline?
Yeah, I can repeat that.
Okay.
So essentially, you get the first shot, you get about 52% protection from the vaccine 7 days or a week after that first shot. Now you wait 3 weeks in the case of Moderna's vaccine and 4 weeks in the case of Pfizer's vaccine. After that, you get the second dose, another 7 to 14 days, 7 to 10 days from that second dose. Then you get full protection, which is 95%. So give or take 50 to 60 days from the time you receive the first dose to the time you actually get full protection of 95%, 94% efficacy. Okay.
We have a road ahead of us, but I am just so grateful for Zeke's Pharmacy offering to help step up to make sure that we could get, vaccinations, especially for our congregate settings and for those that would have difficulty traveling to places like CVS or going out into the community like that. So we're so grateful, and also grateful to the Montgomery County Department of Public Health, and just they've made a strong commitment to provide services for everyone that we serve and their caregivers and their family members who provide care. And it was a very strong commitment. And not every county in Ohio is getting this level of commitment. So I am just so thankful for our community support and the support of our local government in making sure that we will be at the front of this line and that we will be able to get vaccinated. So we will keep you updated. Send me questions and I will make sure that they get answered. And then we'll keep a place on our website where we can kind of share answers. I don't want us to become a healthcare, respondent, because we're not, but we can respond to questions related to our system, what it means, what processes we're using, and then we can connect you with more information. Okay. Thank you all so much. Thank you again, Emmanuel, for getting on here tonight. I know it was late notice and I really appreciate you.
My pleasure.
Okay. Thank you, everyone. Good night. Happy holidays. Stay safe.
Thank you.
Thank you.
Thank you. Same to you.